Hello, welcome to our Doctors in Series live program, our live Facebook feed. This evening, we are so delighted to have Dr. Teresa McConaughy with us. Dr. McConaughy went to MUSC and is our Hospice and Palliative Care Director.
Good evening, everybody. We're going to talk today about advanced care planning, and I hope you all have some questions that you've thought about or will share with us at the end. The topics we'd like to talk about tonight are, I'd like to define advanced care planning, and then we're going to review some components of what I call the conversation. And then at the end, we'll talk about how to document your conversation and your wishes. What is advanced care planning? And I bolded this advanced word on purpose. And I want you all to think about it as the thing that you do to plan for your future medical decisions. Care planning is about putting things in place that will allow you to be prepared for what comes in your health in the future. There are really three components to advanced care planning. The first is understanding. And I describe that as speaking to your physician or your healthcare provider about possible current and future situations that you may face, depending on what your healthcare situation is. You also may face decisions and choices that you have to make in the future. And it's really important to have a conversation with your healthcare provider about those things. The second piece of advanced care planning is really a personal piece, and it's about reflection or introspection. So taking a look at what's really important to you, looking at your goals, your values, your beliefs, and really taking a stock in what is important to you, and as your health changes, what those things that make your life worth living. And the third piece is really the conversation or the discussion piece. And there are multiple people that you need to discuss with. One of them, as we talked about, is your healthcare provider. And you also need to think about who you would want to help make decisions for you or represent you when you get to a place where you can't represent yourself. Let's talk about the conversation for a minute. For those folks who have chronic illness or things that really limit their ability to be independent or autonomous, it's important to talk to your healthcare provider about prognosis or what might be coming down the road for you. I think it's hard to talk about not feeling well or what may come in the future with your illness. But in order to have a plan for the future, you really have to understand what your illness is what you're going to face with your illness in the future. So you need to ask those questions as you go through with your healthcare providers. Back to the reflection piece again, there are many questions you can ask yourself. What matters most is a really easy one, I think, to start with. And as your healthcare changes, or if your time is going to be short, then I think you really need to think about who you want to spend that time with and where you want to be. Is it okay for you to be in the hospital, or would you prefer to be at home? So I think you need to think about those things as you are looking at this advanced care planning. And then the third piece, I think, is who would respect your wishes. We mentioned a few minutes ago having a discussion with someone to make decisions for you. And I think the part of that that's so important is you want to choose someone that you trust. And you don't want to choose someone you trust to make your decisions for you, but you want to choose someone that you know will represent you and speak for you when you can't speak for yourself. I really like this statement. A goal without a plan is just a wish. So as you think about your values and your beliefs, and you come up with some goals for the future with your healthcare, things that are going to be important to you, it's really important to communicate that, what your goals are, to communicate with your healthcare providers, to communicate with your family or that person who you've chosen as your healthcare agent. Because if you don't communicate those things, then really when the crisis occurs, no one will be able to carry out your goal for you. So thinking again, what matters most to you. Another good question is, what are you not willing to sacrifice? A good example here is if you were going to have a surgical intervention like an amputation that would allow you to live 6 months or a year longer, would it be okay for you if you were to have that amputation? Is that an outcome you would be willing to sacrifice? Is that an outcome you would be willing to live with? That's a really specific example, and there are lots of other examples that you can think through. But sometimes I'll tell people to think about their line in the sand, or what they're not willing to go through, or what they're not willing to sacrifice. And the third one is my favorite. What does a good day look like? When you're thinking about your future in healthcare, thinking about things that bring you joy or allow you to have a good day. And that's a very personal thing. For some of us, it might be that we get to sit at home with a cup of tea and read a book, or others, it might be going on a hike. Others, it might be taking their dog for a walk. So I think thinking about what a good day looks like for you is very important. I have had some patients who have said to me, eating chocolate ice cream and watching football is a good day for me. So I think it's a very personal value that people have, and it's important to think about that. I'd like to run through some of the advanced care planning documents that are out there, just to clarify what documents will do what for you, so that you have a better understanding of that. The first one is a living will or advanced directive. The living will is an older term, but it's still used today. We try to refer to it as an advanced directive most of the time. And then the second one is a healthcare power of attorney, and we'll talk a little bit about that. The healthcare power of attorney is that designation paperwork where you choose the person who you want to be your medical decision maker or healthcare agent, and then you put that into writing. Many times the advanced directive and the healthcare power of attorney are a combined document, so you may see that as well. The third one is a DNR and a DDNR. The DNR stands for do not resuscitate, and that is primarily used in the hospital as an order. And when a physician or a healthcare provider writes an order for do not resuscitate in the hospital, it is only applicable to the hospital. So when you leave the hospital, that no longer exists. There is something called a durable DNR or DDNR, which is a document that allows you to have a do not resuscitate order in the community or in a long-term care facility. So a place that is not in the hospital. The fourth thing we're going to go into a little more detail about is something called a Postform or a physician's orders for scope of treatment document. And we'll talk a little bit more about that. This is an example of a Virginia Advanced Directive for Healthcare form. It is actually a 3-page document. I only have the first page up on the screen. There are many, many different advanced directive documents. Many organizations have put together different documents. There's something called 5 Wishes. There's something called Prepare for Your Care. So there are many different forms of an advanced directive. I chose this one just because it was a simple form, and it's the sort of the state form. There this is one of those documents that is a combined advanced directive and power of attorney, healthcare power of attorney document. So in the top section, it includes a place where you can write in your healthcare agent and then a secondary agent so that you have a backup person as well. It allows you to put in general guidelines about your healthcare in the future, and it is intended to be completed by anyone over the age of 18 who has medical capacity to make decisions. You do not have to have an attorney to complete this document, and you do not have to have a notary to complete this document. What you do have to have is 2 witnesses. It has to be signed by the patient, and it has to be witnessed by 2 folks. This document, again, is a general guideline about what healthcare wishes you may want in the future. The durable do not resuscitate form, this is what it looks like, and it is recognized by emergency medical personnel. So if this document is completed and signed, it is respected by anyone who is in the emergency medical field. It's important to complete this and check boxes. It needs to be signed by the patient or the patient's healthcare agent or representative, and also needs to be signed by a physician. The advanced medical directive that we spoke about a few minutes ago does not need to be signed by a physician. It's important to share it with your physician, but it does not need to be signed. This document is kept in the patient's home, but it's very important to also share this with your healthcare provider. This is the physician orders for scope of treatment, or the Postform. Like the durable do not resuscitate form, this is also durable, and that means it's portable. So it can travel from healthcare facilities to the home, and it is applicable to any care setting in which the patient finds themselves. It is intended to not to replace other documents, but to add to those documents. The folks who would complete a Postform are people who have advanced or serious illnesses. And typically we talk to folks who have a life expectancy of 1 or 2 years about completing this document. There are 3 different sections. The top section is just like the durable do not resuscitate, it is a resuscitation section. So it's either attempt resuscitation or do not attempt resuscitation. The lower portion is about medical interventions that you may or may not want. And I think it's important to really discuss this with your healthcare providers. This is where that conversation about prognosis and future events that you may face really plays an important role in the discussion about how you complete this document. There's a place to sign for both the patient and the medical provider. So it is intended to be signed by a medical provider. So why is it important to document this? We've spent a lot of time looking at forms, and I think there is really an important piece to this. And I think we can't honor your wishes if we don't know what they are. So communicating to anyone who's involved in your care, your healthcare team, your healthcare agent, family members, people who care about you, that you want them to know what you want for your future healthcare. It's nice to have it in writing because that would allow those wishes to be respected, even if you aren't able to speak. So the advanced care planning documents must be reliable. And I use that term because I've seen many advanced directives over the years that there's only one witness, or there's no witnesses. And those forms are actually not reliable and accurate if they aren't completed correctly. On the do not resuscitate form, if the durable form, if the boxes are not checked, then it's not considered to be a reliable or an accurate document. So when you are completing these, whether it's with your healthcare provider or with your family members, it's important to make sure you fill in all the blanks and sign all the lines that need to be signed. Having visible documents is very important in our world of electronic health records. Being able to make sure that your documents are in your electronic health record, and that your physicians, your providers know that they're there and that your wishes are already on paper is very important. So making sure that the copies that you want to get to your healthcare team are in the electronic record. And the last piece is accessible. I've had many conversations about advanced directives, and people who have told me they have them in their safe deposit boxes in the bank, or they have them in the attic with their financial papers, or they have them in a box in the basement where no one can get to them, no one can see them, and no one really can honor those wishes because they can't even find them. So making sure that you have the documents completed properly, share them with the people that they need to be shared with, and keep them where they can be found if you can't tell someone where to find them. So I'd like to summarize a little bit and just talk a little bit about the definition. I think is an important one for advanced care planning, to do this in advance of a crisis. So we don't know what's going to happen from one day to the next. We are living in a time where that is very evident. So I think it's important to think about what's important to you in the future and plan for that. I hope I've given you some tools to allow you to talk to your medical team, and some tools to reflect and use some introspection to think through what's important to you. And then lastly, to be able to document these wishes and share them with the people who matter most and who are involved in your care. Thank you.
Thank you. We had one question come in through our live stream tonight. Okay. And the question is it my spouse automatically my healthcare decision maker? Can you address that and touch on that just absolutely. A little bit more? Thank you.
It varies from state to state. So in the state of Virginia, there is what's called a decision maker hierarchy. And yes, if you have a spouse, that spouse is automatically your decision maker. Many times people will choose someone other than their spouse because of health reasons or other reasons. So I think if your spouse is acceptable to you, then that will be the first choice.
Thank you. We appreciate everyone joining, and thank you, Doctor, for your time. If you have any other questions, please feel free to comment those and we will address those. Thank you.